So you've had a routine mammogram to screen you for any possibility of breast cancer. It came back as normal. But what if I told you that that doesn't always mean that you are in the clear? If you had a mammogram and you were told everything is fine, that the result is normal, please watch this till the end because there is something that your doctor may not have told you. Some women have what we call dense breast tissue. This is an example of a dense breast tissue, and this is an example of a breast imaging that shows a woman who does not have dense breast tissue. Now, here's the problem. On a mammogram, dense breast tissue appear as white. As you can see in this picture, the tissue throughout the breast just look white. Breast cancer, on the other hand, also looks white. For a woman who does not have dense breast tissue, the image that we see from the mammogram look less white. So it's easier to pick up breast cancer on a mammogram when the breast tissue does not look diffusely white. In other words, women who do not have dense breast tissue, as can be confirmed on the mammogram, are more likely to have their breast cancer identified on a mammogram. But if your breast tissue are dense on a mammogram, it is very easy to miss a breast cancer just by relying on a mammogram, because the tumor that also looks white on a mammogram can be hiding in plain sight amongst the dense white tissue that is seen on the mammogram. And that dense white breast tissue that is seen on the mammogram will camouflage the white appearance of the breast cancer or the breast tumor, thereby making the breast cancer completely invisible. Therefore, your result coming back as completely normal. Ladies, this is not a scare tactic. This is documented and real. This is why it has been found that women with dense breast tissue are at a higher risk of what we call interval cancer, a cancer that is found between screening rounds simply because the mammogram missed it the first time round. So here is what you need to do. After having your mammogram, always ask your doctor to give you the report, not just the result, the actual written report. And on that report, what you need to be looking for is the density of the breast tissue that will be documented on the report. The density of your breast tissue will be categorized as A, B, C, or D. If you are a C or a D, your breast tissue is dense. So you therefore need to move to step 2. Go back to your doctor and say, hey doc, given the fact that my breast tissue is dense, should I be having any additional tests? And your doctor's answer should be yes. You would benefit from either an MRI scan or a contrast enhanced mammogram. If your doctor does not tell you that and you've been given a category C or D, you need to inform them. You need to prompt them. Remember, it's your health. An MRI uses no radiation and is able to see through the dense breast tissues. There is also contrast enhanced mammogram, which uses a dye injection alongside the mammogram. And this dye will highlight anything that is suspicious that would have been missed by a standard mammogram. A normal mammogram result is not the full picture. Being armed with information, lady, you are your own best advocate. Ask questions. Know your breast density. If you need more, push for it. It is your health. Share this with any woman that you know has had a breast mammogram and has possibly been told that her result is normal. Most especially if, despite being told that her breast mammogram is normal, she is experiencing breast symptoms that are concerning. I'm Dr. Kady. Follow for more women's health content.